Here's something that might surprise you. While most of us take roughly 20,000 breaths per day without thinking, over 300 million people worldwide struggle with every single one of those breaths due to asthma. Those numbers are staggering when you really think about them. And what's even more interesting is how our understanding of asthma management has evolved. And the managing of this complex condition involves a combination that could be looked as an intricate dance between pharmaceutical interventions and complementary natural approaches. First things first, what is asthma and what happens during an attack? I think understanding the basics helps explain why we need such a comprehensive approach. Asthma is a chronic respiratory condition characterized by airway inflammation, bronchospasms, and recurring episodes called asthma attacks. Picture your airways as an intricate network of tubes. During an attack, three distinct things happen simultaneously. The muscles spasm, the lining becomes inflamed, and there's this overwhelming production of mucus. It's like your body mounting an excessive defense against an imagined threat. Hmm. And I understand different triggers can set this whole process in motion, right? And here's where it gets really interesting. Recent studies show that up to 75% of asthma attacks are triggered by factors we might not expect. Sure, there are the obvious ones like allergens, but emotional stress and even changes in barometric pressure can trigger attacks. Now it is necessary to assess symptom frequency. So you got to pay attention to whether it is occasional, which is around twice a week, or are the symptoms a daily occurrence, including nighttime awakenings? The common pharmaceutical interventions are based on the frequency of symptoms. So, for infrequent occurrence, there is the as needed relief, which includes short acting beta agonists, including albuterol or Xopenex for immediate relief during attacks. Now, if the symptoms are a weekly or daily happening, then there is a need for regular control options, which are combined inhalers. Inhaled corticosteroid plus long acting beta agonist, or inhaled corticosteroids alone for daily inflammation control. And lastly, leukotriene receptor antagonists to reduce inflammation and relax bronchial smooth muscles. Well, that certainly explains why treatment approaches have become so multifaceted. What's the latest in pharmaceutical developments? The newest generation of combined inhalers is pretty remarkable. They're using advanced delivery systems that can target specific areas of the lungs with unprecedented precision. Some studies show they're up to 40% more effective than traditional inhalers when used correctly. And what about these natural approaches? There is growing evidence supporting their use, and the specific ones are vitamins including B6, B12, C, and E, specific minerals such as magnesium and selenium. Some herbs and extracts that have been looked at are quercetin, grapeseed extract, Ephedra sinica, Glycyrrhiza glabra, Camellia sinensis, green tea, Tylophora asthmatica, and Coleus forscohii. Now, this is where things get really interesting. Take the Buteyko breathing technique. It is breathing method that teaches you to breathe through your nose in a calm, gentle way instead of taking big breaths through your mouth. Imagine you're trying to make a feather float in the air. Now you want your breathing to be so light and quiet that the feather would barely move. The clinical trials show it can reduce reliance on rescue inhalers by up to 90% in some patients. Then there's black cumin seed oil, which has shown a 50% reduction in inflammatory markers in recent studies. The mushroom cordyceps has the potential to lower asthma related inflammation. Research has shown cordyceps contains compounds like cordycepin and adenosine that demonstrate anti inflammatory effects in respiratory pathways. A 2011 study in the Journal of Ethnopharmacology found cordyceps reduced airway inflammation in mice models of asthma. Our culinary friend garlic contains compounds that reduce airway inflammation, support the immune system function, and can potentially decrease allergic responses. Oh my goodness. A 2016 systematic review in the Journal of Alternative and Complementary Medicine analyzed 15 studies showing yoga practice improved pulmonary function and quality of life in asthma patients. Specific benefits included reduced use of rescue inhalers and improved peak expiratory flow rate, though study quality vary. Pretty fascinating, right? So, how do healthcare providers typically view combining these different approaches? Well, we're seeing this significant shift in the medical community. About 60% of respiratory specialists now recommend some form of complementary therapy alongside conventional treatments. The data shows patients using this integrated approach have roughly 40% fewer emergency room visits. I've heard some surprising things about the gut lung connection in asthma management. Oh, yeah, this is mind blowing stuff. Recent research shows that people with certain gut bacteria profiles are up to 30% less likely to develop severe asthma symptoms. It's completely changing how we think about respiratory health. So, what would you say is the most promising development in all of this? Without a doubt, it's the emergence of personalized treatment protocols. By analyzing specific inflammatory markers and genetic factors, doctors can now predict with about 80% accuracy which treatments will work best for individual patients. It's revolutionizing how we approach asthma management. That really shows how far we've come from the one size fits all approach of the past. And here's what's really exciting about the future. Artificial intelligence is now being used to predict asthma attacks up to 48 hours before they occur, with an accuracy rate of around 90%. Imagine how many emergency room visits that could prevent. Sounds like we're entering a whole new era of asthma management. Now, you know what's really important to emphasize here? While all these advances are exciting, working with healthcare providers to develop a personalized approach is crucial. The data shows that patients who do this have about 65% better outcomes than those who try to manage their condition alone. That really seems to be the key takeaway, this idea of comprehensive, personalized care under professional guidance. As we wrap up today's discussion, remember that asthma management isn't just about controlling symptoms. It's about optimizing overall respiratory health through this fascinating combination of modern medicine, natural approaches, and emerging technologies. The future of respiratory health has never looked more promising.